Hello, I'm Dr. Steve Hotze, and welcome to Dr. Hotze's Wellness Revolution webinar. Today, we're going to be visiting about regenerative medicine, specifically about stem cell exosomes. Now, I believe that you and every person needs to have a physician who can coach you onto a path of health and wellness naturally. You need to have a physician that has the know-how and the wherewithal to do that, so that as you mature, you've got energy, vitality, and you're enthusiastic about life. Yeah, let me ask you a question. When you woke up this morning, were you alive? Were you awake? Were you alert and enthusiastic? I hope you were, and you can be. Get up and tell yourself that every morning in the mirror, that you're the most enthusiastic person you know. Well, I'm enthusiastic about this webinar today because we're going to be talking about a very exciting extension of regenerative medicine, which we practice here at the Hotze Health Wellness Center. Now, many people have said, well, you practice, natural medicine or complementary medicine or integrative medicine or functional medicine. A lot of other terms for the type of medicine we practice, which I call natural medicine, but really it's regenerative medicine. Why is it regenerative medicine? Because it helps regenerate the cells in your body as they age. It rejuvenates them. And the program is really very simple. And what causes the deterioration as we age is very simple. Why do people get old and don't feel well and have a host of symptoms, from fatigue to joint muscle aches and pains to poor bowel function to poor memory, poor sleep, weight gain, gastrointestinal problems, maybe menstrual irregularities, recurrent and chronic infection? Why do people just start getting sick as they get older? Well, inevitably, our bodies begin to deteriorate as we age. And why is that? Well, because we lose our hormones, sex hormones, adrenal hormones, and thyroid hormones begin to decline, and all those are important for producing energy in our body. We maybe have taken antibiotics and we got yeast overgrowth in our gut and in our intestines, and that causes toxins to be, excreted into the system and gets in our body and makes us sick. We have problems with not enough vitamins and minerals in our diet. We don't eat good foods. We're eating a lot of simple carbs. We've got too much sugar in the diet, which is highly inflammatory. And we don't exercise. All these things contribute to a decline in our health. So if we're going to be healthy and well as we mature, if we're going to be alive as we age and have vitality and energy and get up and go and enthusiasm, well, we got to have energy in our bodies. We've got to be producing high levels of energy. So we've got to reverse the trend of the decline in our energy. Low voltage individuals, remember, the energy that we produce in our body is electrical energy. So we want to produce high levels of electrical energy so that we are high voltage individuals. We're live wires. That keeps the brain functioning well, the heart works well, the lungs work well, all the organs work well, our muscles, our joints work well, and we feel vital. My philosophy is if you're going to be alive, you might as well feel alive. So I do believe that you and everybody's responsible for their own health. I'm not responsible for your health. I'm responsible for my health. The government, your insurance companies, your spouse, your doctor, nobody's responsible for your health. You have got to take charge of your health. And I believe when you do that, you can prevent a host of problems that occur as we age. So I believe most health problems are preventable. Heart disease is a classical one that can be easily prevented through the proper eating healthy, maintaining your hormone levels at a good level, particularly thyroid, getting on the proper vitamins and minerals, high dose of vitamin C, exercise. All these things contribute to a healthy heart long term. I believe most health problems are preventable, and I believe when people have health problems and health issues, when they take pharmaceutical drugs, they're literally poisoning their body and they're making their body more toxic. Remember, the reason we're sick is because our bodies get toxic. Why do they get toxic? We're exposed to all kinds of petrochemical products in the environment. And when we breathe, eat, drink, slather on our bodies, we have all kinds of metals that we come in contact, aluminum from cooking in metal, lead that's in the environment. We have problems with mercury. Why? It's in the environment in the fish we eat. It's also gets in our mercury amalgams in our teeth when we have dental fillings. a high carbohydrate diet turns to sugar, and that's highly inflammatory, and that causes health problems, and we get infections. That causes inflammation. All these things tend to cause our power plants in our cell to be toxic and produce low levels of electrical energy. Those power plants are called, as you know, mitochondria. You learned it back in biology, and I'm trying to teach you that again. I wrote about it in my book, Dual 180. Take charge of your health and join the wellness revolution. I talk about the mitochondria. That's a power plant. Every cell in your body has one or multiple power plants to produce electrical energy so that your body can operate and function. You've got to have electricity, just like our room, in order to have lights, has to have electricity. Your refrigerator has to have electricity. Your air conditioning unit has to have electricity. Your bodies have to have electricity, and you make your own electricity from the nutrients you consume, from the vitamins and minerals that you have in your body, from hormones. All these things contribute to the production of electrical energy. So that's what's most important. Now, so when we replenish these hormones, when we give you recommend vitamins and minerals and nutrients, when we treat you to get rid of the toxic load of yeast in your system, when we encourage you to eat healthy foods and to eliminate the simple carbs as much as possible because they convert to sugar, which is highly inflammatory. When we encourage you to exercise, all these are part of regenerative medicine to revitalize your cells and keep your cells from deteriorating. We want to arrest and reverse that. So as you age, you still feel vibrant and alive. Now, the next cutting edge in regenerative medicine is stem cell exosomes. Now, stem cells are cells that are pluripotent, pluripotent cells. They can convert to any cell in your body. They're the base cells out of which every other cell is made. So when you were an embryo, you were basically just stem cells, and those stem cells differentiated. They were told to by the DNA in your body and the chromosomes that you need to differentiate. So some of the stem cells became muscle, some became brain, some became heart, some of them became intestines. They all transformed into those particular cells. And your body still has stem cells in it, and we have less and less as we age. But those stem cells, when there's an injury, go to the site of injury, and they secrete specific products, bioactive molecules, peptides, proteins, cytokines, growth factors, a multiplicity of different molecules to communicate with those injured or damaged cells, telling those cells how to get well, to revitalize, to regenerate. It also cuts down on inflammation when there's when there's injury. It also modulates the immune system to keep from the immune system from overreacting to injury. So the stem cells are very important in the production of specific bioactive molecules that will keep your body healthy and well. As we age, guess what, folks? We don't have as many stem cells, and they get to be old and they're tired, just like we are. And so they don't produce as much exosomes as our body needs. And so what happens inevitably with the loss of hormones and everything else. And by the way, hormones and eating correctly and exercising, all these stimulate you to produce good, healthy stem cells even as you age. That's why it's regenerative in the type of medicine we practice. But we want to get to even a higher level, and that is by using exosomes. And we get these exosomes. These exosomes are derived from placenta and umbilical cords that come from full-term delivery in women that have had cesarean sections. And so these placentas are captured by the hospital, and then there are lab companies that purchase these placenta, and they take the stem cells out, and the stem cells are grown and produce exosomes. And the exosomes are what the stem cells secrete in order to communicate to the cells how to regenerate themselves. God has given the body amazing restorative powers, regenerative powers, and we want to amplify those. And by taking allogenic, that means stem cells that come from outside our body, You could get them from your body, and I'll tell you about that in a minute, but we get them from outside our body, and then we grow them, and then we take the exosomes. The exosomes are quarantined. They're sent off for sterility studies for 6 weeks. They're characterized to make sure they have the right molecules in them. And then once they're released, we can take and give those either by intravenously, or we can inject them into areas of the body that need specific help, like your joints. And that's what I want to talk to you about, is osteoarthritis. Half the people above the age of 60 have osteo or degenerative arthritis. That means you've got inflammation in your joints, and the inflammation deteriorates and destroys cartilage. You got to have cartilage so that your joints have something smooth when they open up and close. When you move your shoulder, you've got cartilage so it doesn't grind. When you get osteoarthritis, the cartilage is removed, and now you've got bone on bone, and it's grinding. Which means bone, arthritis, inflammation in the joint. So the bones in the joint get inflamed because they don't have cartilage. So what can be done, and here's what conventional doctors routinely do. They give you anti-inflammatory, an NSAID, a non-steroidal anti-inflammatory, ibuprofen. You all take it all the time. You take Advil and all these drugs that have ibuprofen in them. Ibuprofen and these other non-steroidal anti-inflammatories have side effects. And one of the major side effects is it causes coronary artery disease. Oh yeah, but Dad died of a heart attack, but at least he didn't have his joint pain anymore, right? Well, they help decrease the inflammation in the joint, but they don't repair the joint. Some doctors will put in cortisone injections in your joints. I've had that before. Maybe some of you have had that as well. That relieves the inflammation, but it doesn't regenerate. It doesn't revitalize the tissue. So the chondrocytes, which produce cartilage, are stimulated to produce cartilage. It doesn't do that. Other people, people take pain relievers, all sorts of things trying to relieve the discomfort they have from the osteo, or we also call it degenerative. It's degenerative arthritis. Your joints are degenerating. We want to regenerate your joints. Now, what happens invariably when people have degenerative arthritis, it gets so bad, they go see their orthopedist and they get their injections of cortisone and all that. And after a year or two, it just doesn't work and they get worse and worse. And they can't hardly go up and down stairs, and they're hobbling around. They can't participate in any sports anymore. And so the orthopedist tells you to do what most good orthopedists want to do. Why don't we do a knee replacement? And they will recommend a knee replacement. Or if it's your hip, a hip replacement, or a bad joint in the shoulder, they recommend shoulder replacement. But let's just talk about replacement of the joint. So you have this chronic problem of arthritis, degenerative arthritis in your knee, hip, or shoulder. And what they want to do is they want to cut off your knee. They want to cut you off of the knee and put in a new knee replacement, which in some people, it works out very successfully. Now, if you could repair your joint without doing that, it would be much better, wouldn't it? Because there's downtime. You got months and months of downtime with this new knee joint, and about 20 to 30% of the time, people aren't satisfied with them. They're off a little bit, or they don't fit quite right, and maybe their one leg is now a little shorter or longer than the other, and it causes, once you get that knee replaced, well, then it's going to maybe it's not quite balanced right, or not the right size, or not the right length, and then the other knee has to kind of hobble around. Next thing you know, you're getting your second knee replaced, and then that affects the hips, and next thing you know, you got a hip replacement. Well, wouldn't you rather see if you could repair that naturally, regenerate new cartilage in your joint so you don't have the chronic inflammation? So the most important thing you can do to prevent and then to help decrease joint inflammation is what do you think I'm going to say? It's changing your eating habits. You've got to get down to an ideal body weight. Degenerative joint disease is most commonly caused by carrying around too much weight. And most Americans, 70% of Americans, are carrying around too much weight. And what does that what is the joint that bears the biggest brunt of this? Well, the knees certainly bear a majority of the brunt of this. The lower back also. If you got back pain in your lower back, that's because your weight is too much and your center of gravity is falling forward. So that puts pressure on the lower back. Also is going to affect your hips. But the knees tend to be the most common joint that's affected by degenerative arthritis. And degenerative arthritis, primary cause of it is not because you've been running too much or you're jogging, although joggers have all kinds of problems with their bones and their joints. And that's why I don't really recommend running on concrete. I don't care what kind of shoes you have. I've just seen too many problems with knees. These people that have run for years and years on concrete, it deteriorates their joints and their knees. So, but if you're carrying around too much weight, you're going to have some degenerative arthritis. Eventually you'll get that. And eventually what will happen is you're going to end up getting a knee replacement, which is going to cost you downtime. And it's going to cost tens of thousands of dollars for the replacement. I don't know what it costs, $30,000, $40,000 for the knee, $30,000 for the surgery. It's a lot of money. Whatever it is, there's a lot of money, and you're going to have a copay on that anyway. And then you've got foreign body in your body. You've got, I don't know if it's titanium or whatever they're making the knee out of, the material. It's foreign to your body. And I just don't think that's healthy. Wouldn't you rather have your joint be repaired naturally? So this is what stem cell exosome therapy enables you to do. By simply going into your joint and injecting stem cell exosomes with some platelet-rich plasma, which is just derived from your blood, that binds to the exosomes and it keeps it located in the joint space in your knee or hip or shoulder. And what that does is it causes the chondrocytes, which make cartilage, to revitalize and regenerate. It also cuts down on the inflammation. It's anti-inflammatory, and it moderates or modulates the immune system so we don't have a bad reaction from the chronic wear and tear on that knee. It's different than the conventional medication for joint and knee, which is the anti-inflammatories, the aspirins, the cortisone injections and pain relievers. None of those stimulate revitalization and regeneration of the joint tissue. And that's what you want. And so here at the Hotze Health and Wellness Center, I've been so excited that we're bringing on now stem cell exosome therapy. For a number of years, I've wanted to do stem cells. But because of certain rules and regulations that the FDA came down with 5 or 6 years ago, the type of stem cell therapy that is beneficial for regenerating joints was not allowed in the United States. And that's where we would take stem cells and we would grow them into hundreds of millions and inject those into the knee. They, in turn, would produce exosomes. Unbeknownst to us, we used to think those stem cells turned into cartilage, but they don't. They produce exosomes that stimulate the tissue already in your knee, no matter how meager it is, to revitalize and to regenerate and to rebuild the cartilage in your joints. That's what the exosomes do, and they have been very effective. Now, I've been to several conferences on exosomes. I've been to several physicians' offices that use exosomes for the treatment of joints, as well as a multitude of other systemic health problems. They use that to address those problems. But specifically for the joints, they have had absolutely incredible results with the joints and have helped individuals prevent from having to have joint replacement surgery. And that's what we want to be able to do. So that's what we're offering here at the Hotze Health and Wellness Center. And I want to encourage you to take advantage of it. Don't get so far gone that you have to have your knee replaced. I'm telling you, I don't have to tell you, you can find out for yourself. It's much better to regenerate and restore your joint to health naturally rather than having some invasive surgery. Listen, these surgeries all come with complications. You know as well as I do, many surgeries, I can't tell you the number of people I've known that have had surgery on their joints and they get secondary infections. Nosocomial infections are these drug-resistant bacteria that live in the hospital that glom onto these in the surgery patients. And you know people too that have get these various bacterial infections that are very hard to treat because the bacteria are resistant to the antibiotics. That's why we want to do everything we can to prevent surgery. So here at the Hotze Health and Wellness Center, we're now offering stem cell exosome treatment for joints. And we'll be talking next week about IV stem cell exosomes for addressing some systemic health problems, everything from brain function to lung disorders, cardiovascular disorders, gastrointestinal problems such as ulcerative colitis, kidney disorders. The stem cell exosomes, when they're put in IV, they go to areas of your body where you're having problems. It identifies those, and then it stimulates revitalization, regeneration, calming of the immune system, and an anti-inflammatory effect on those areas of the body that have had problems. So I'm so excited about this. I haven't been as excited about this since 20 years ago when I learned about bioidentical hormones and the wonderful effect and positive effect and beneficial effect it has on individuals as their hormones decline and become imbalanced. That was a huge step forward in our medical center. We started with allergies, which was a huge step forward from conventional medicine. We treated for yeast problems. We used vitamins and minerals. That was our treatment program. Then we added thyroid. Then we added bioidentical sex hormones and adrenal hormones. Then we got into a good nutritionally balanced eating program, ketogenic eating program primarily, and then we recommend exercise. And this has really helped many of you get on a path of health and wellness naturally. It's enabled you. What we want you to do is to regain and maintain health and wellness naturally, so you've got an enjoyable life as you mature. Why wouldn't you want to be alive as you mature and feel good and be active? Now we're going to the next level. We're going up to stem cell exosomes, and this is going to take us to a completely different level. I just got through reading Dr. Reardon's book on stem cell therapy, and he has a stem cell clinic down in Panama. Dr. Reardon, Riordan, fabulous work he's done. I spent time with Dr. Tom Loeb up in Chicago 2 weekends ago. Wonderful work that he does with stem cell exosomes. Everything from autistic kids to people with dementia, to people with joint problems. This is the book that really has me excited, Stem Cell Therapy. And remember, stem cells produce exosomes. I like to describe it this way. The stem cells are like an oil refinery. Oil refinery gets crude oil, and that crude oil then is converted to gasoline, diesel, butane, propane, all sorts of petrochemical products. Those petrochemical products are then shipped to the various industries where they're needed. When you go to a gas station, you don't say, give me a refinery in my car. No, you say, give me some gas. So you fill it up with gas. Gasoline is what your car needs to run on, right? The stem cells are like the refinery. The gasoline is like the exosomes. You need the exosomes so that your body will run normally. It's also good just to stimulate your body, even if you're feeling well, the anti-aging effect and the stimulatory effect that these stem cells have on your body. I use it myself personally, and I feel great, but I use it and I spread it out every month or so. I take some exosomes. Why? Because I want to keep myself vibrant. I want to keep myself healthy. I want to keep myself motivated. I want to keep myself enthusiastic. And I know if I feel well and I'm healthy, I have a much better chance of being enthusiastic than if I'm sick and tired all the time, right? So this is a great opportunity for you. If you're interested, and you should be interested in stem cell therapy, and you know people who are stem cell exosomes, don't hesitate to call one of our guest consultants, and we'll put the number up here. It's 281-698-8698. You can give a call to them and see if you'd be a candidate for that. What do we do when we before you by being evaluated? Well, we could do a CT scan of your joints to see if you have any degenerative arthritis in the joints, but your history tells us that, right? But we just look at that. The other thing we can do is we can do MRI, which is magnetic resonance testing, and we can check your joints that way to see how thick the cartilage is. We can do that before the treatment, and then several months after the treatment to see what kind of improvement you're getting objectively. But you're going to know this. You're going to know this. And how long does it take for the joints to start feeling better? It can be several months. But I've had guests here of ours that within just a few weeks, they felt better. Their knees weren't hurting. They weren't swollen. They didn't have any clicking in their knees, and they really had tremendous results. In talking to the doctor, to the physician, I talked to a provider in Denver, and I went for some training on injections. I went with Debbie Yannick, our nurse practitioner, for injections in the joint, just to get trained right, to make sure we know how to inject them right and how to use our ultrasounds to make sure we get into the joint space, which is pretty straightforward once you know how to do it. Want to make sure we're able to do that. This practitioner is doing 100 knees a month. Now that's remarkable, just knees. That's not talking about hips or shoulders, probably about half that number of hips, about 40 or 50 hips a month, and 10 or 20 shoulders a month using exosomes. She's been doing this for 8 years. Now, you don't have that many people coming in to an office if they're not getting well. They're referring all kinds of people. They don't do any marketing except word of mouth. And they're covered up with people because there are people out there like you who would prefer to get their joints healthy naturally without having to get your joint cut off at the knee and put in some kind of joint replacement. We don't need that. We want to do this naturally. And that's why I'm excited about stem cell exosomes. I hope you can feel my excitement about it. I really am. And I'm looking forward to I've told our staff we're going to help literally tens of thousands of people or more get their lives back, because you still want to be active. And even though you feel well on our current treatment, you may have joint problems. And until you get your joints healthy and well, you're not going to be able to participate in the things you did when you were younger. We want you to be going and blowing as you mature. So you're like Moses. Did you know that when Moses died, it says in the Bible, I believe it's chapter 34 of Deuteronomy 7, it says when Moses died on Mount Nebo, it said he had sparkle in his eyes and he was full of vim and vigor. He was full of enthusiasm. God took him home at 120. Wouldn't you like to be that way? Full of vim and vigor right now with a sparkle in your eyes. Why don't we do that? So come and give us an opportunity to help you. Thanks for giving us the opportunity you've already given us to serve you, and we look forward to taking you to a new level. This is Dr. Hotze saying thank you so much.